Does your knee cave in while you're doing squats? Well, it might be coming from your foot. Here's how to strengthen it. So one of the main reasons why your knee might be caving in is that you might not have enough inherent foot strength. Basically, the intrinsic foot muscles aren't holding up your arch and you're getting excessive pronation of the foot. Now, that said, pronation is a totally natural movement that occurs in many different types of athletes, and it occurs naturally in the foot as one of the necessary mechanisms in order for you to do stuff like run and walk. However, when you're doing a heavy loaded exercise like a squat, you do want to maintain some amount of supination or at least a neutral foot arc in order to stabilize your body weight on top of your feet. When the foot excessively pronates, it can lead to excessive internal rotation of your tibia, leading to a valgus knee, excessive internal rotation of pelvis and hip, and this can cause pain throughout the whole entire kinetic chain. You can have issues with ankle mobility, you can have knee pain, pelvic pain, SI joint pain, even low back pain, hip pain, name it, it all can be coming from the foot. Now, we can't really say that all issues come from excessive foot pronation. Some people can pronate normally and it won't affect them at all. What really matters is whether or not it's a stable amount of pronation, meaning that it's not out of your control, that pronation is being well controlled and it isn't leading to movement leakages or inefficient loading patterns. So in order to understand whether or not you actually need to level up your foot, we're going to do a quick test to see whether or not this will help to improve your movement mechanics during the squat. The easiest way to kind of test is by using some sort of foam wedge, and what we're going to do is use this to provide some medial foot support during your squat. What it essentially will do is prevent your foot from overpronating by acting as a physical block. And if you find that your knee movement mechanics do improve, your pain and symptoms improve, then that is an indication that you might need to do some foot strengthening to help alleviate a lot of the symptoms you're experiencing. So what you do is you actually only put this on the bottom back half of what we call your calcaneus or your heel. So what you're going to do is you're going to put it just halfway through the heel. So if you're actually taking a look from the back angle of my foot, you'll notice that it doesn't going all the way through to the other side, it stops halfway. So now that your calcaneus is physically blocked from overpronating, when you do your squat, you should notice that your knee doesn't cave anymore. And if it still caves in, then it's an indication that maybe it's not foot mechanics that's affecting your squat. Maybe it's actually hip mechanics that are in knee stability coming from the hip. And we do have a video of that. You could take a look at our library of videos to find that one, or I could link it in the caption below. Other than that though, if you find that it does help to either make your squat smoother, allow you to squat deeper, alleviate some of the symptoms like hip pinching or knee pain or pelvic pain or low back pain, or if just visibly it does improve the way that your squat looks, then it's an indication that we need to work on stabilizing that foot pronation. If you don't have something like a wedge, you could use something like a heavy monster band instead. What you can do is you could grab this thick green band and you could fold it upon itself so that it acts kind of like a wedge, and then you're going to place this in the same spot that you would place the wedge. So you're going to put that on the inner half of your heel, and you're going to make sure it's super solid, and then you're going to do the same exact thing where you're going to squat down and see if that helps to improve your knee mechanics. So if that quick self-check does help to improve the way that things feel or move, then continue watching the rest of the video. If not, you probably want to watch another video, but you can keep watching anyways to learn a little bit more about movement mechanics. So the first exercise that we're going to be doing to build the fundamental intrinsic foot strength is the short foot exercise. And this exercise is called short foot because if you're taking something flat and you're giving it a bit of a bridge because you're trying to supinate the foot will get a little bit shorter. So as you can see visualized here, if I line up my toe with this line of the gym tile, if I engage my short foot, you can notice that I lose almost like a shoe size in my foot. The other thing that you want to realize is when you're doing this exercise that it's coming from the intrinsic foot muscles and not your calf muscles. So some of your calf muscles are supportive muscles for the medial longitudinal arch of your foot. We want to make sure that we're trying to build intrinsic foot strength though and not using your calf to compensate, because that'll affect your movement in a different way. The other thing is that you want to make sure you're not pulling from the flexors of your toes either. What that'll usually look like is when you're doing the short foot, you'll see hammer toeing of your toes because they are pulling from your toe flexors instead. So let's get into this right now. So when you're feeling the muscles contract, you'll feel the muscles along the medial longitudinal arch tense up. Now, if you're new to this exercise, often it'll feel like the muscles are about to cramp on you. And if that's the case, I usually say go all in into that feeling because a lot of people have a hard enough time actually even getting to that point to begin with. And usually cramping in this scenario is a sign of deconditioning. So if you do feel a lot of cramping going on, it's usually an indication that you need to actually start strengthening this foot up. So from there, if you need some help with the mind-muscle connection, because for a lot of people who aren't used to using their feet, they'll have a hard time feeling a muscle that they haven't used in a long time contract in isolation. So you could do something that we call proprioceptive taps, which is just tapping the muscle that you're trying to engage so that you can feel that muscle contract. So from there, what's really important is that you have to keep two things planted on the ground at all times. That is going to be your heel and the base of your first toe. And that's because the medial longitudinal arch runs between those two areas. So similar to kind of like a rainbow or a bridge, you need both ends anchored down to the ground. If you don't have one of those things on the ground, then all of a sudden you can't really cause any type of contraction in the right areas. So from here, I'm going to take my foot, which as you can see is naturally pretty flat, which is okay. It's not about whether or not you're flat-footed or not. It's about whether or not you can control your arch. As you can see, I'm pretty flat-footed here, but I can engage my arch to occur, and you can see this upside down bridge form. Now, the other thing that you'll notice is when I'm doing this, I can have full freedom and control of my toes. I can do toe pianos or yoga toes just like that without that arch collapsing. And this is an indication that I'm not using my toe flexors to increase the engagement of my arch. So what you should notice is that while I'm doing this, I can actually feel my calf and is super loose and jelly-like. And that means I'm not actually contracting this muscle belly to pull my foot into supination or even to a neutral position, okay? So if you have a hard time separating that motion, I like to just kind of play with my calf and just kind of shake it up a little bit to kind of get that muscle to loosen up. And what you should notice is that just like by shaking it back and forth, that it kind of coaches your brain to kind of loosen that muscle up. And just you want to think intentfully about loosening that muscle up when you're doing that as well. If you're having a particularly tough time activating that foot still, there is one way that you could kind of hack your body into understanding what it needs to do. So what we can do is take advantage of what's called a windlass mechanism of your foot, which is when you dorsiflex your big toe, naturally your arch will activate. And this is a mechanism that's just built into our bodies. So what you can do is by pulling your big toe up, you notice that the arch is there. And then from there, you could try to contract the muscle by pulling or thinking about pulling the base of your big toe towards your heel. Okay, and this is particularly good modification of the exercise to do, especially if you're the type to lift that base of the big toe up because you're trying to just pull with your toes instead of your foot. So you're just going to pull that big toe up, feel that contraction, and you're going to practice doing this daily. Now, when it comes to practicing this short foot exercise, you're going to do it multiple times in a day. You could do this upwards to 4 to 5 times within the day, and you're just trying to hold the contraction for up to 10 to 30 seconds. It really depends on what you can manage, and try to play with the positions that you're doing. So I like to tell my patients to practice this sporadically throughout the day. You're going to do this standing, sitting, shoes on, shoes off. You do it while you're waiting in line at Starbucks. You're just going to try to practice activating that foot and build that mind-muscle connection. Truthfully, it can take up to 3 weeks for you to start feeling a solid contraction in that foot. 3 weeks is roughly the amount of time that it takes for neuroplastic changes to occur, which is where we're stamping in a movement pattern into our bodies. That's just how long it takes sometimes. Some people can get it right away, and then you can start utilizing it immediately. But in the beginning stages, it will take up to a month, and it'll be a pretty frustrating experience. At least it has been for a lot of my patients, but once you kind of get it, it's good. And whether or not you pick up on this quickly or it takes a long time, it just varies from person to person. Now, say you have figured out how to activate this foot without compensating with your toe muscles and without compensating with your calf muscles. The next step is to then load the short foot position. So what we're going to do is from a similar position, you're going to have yourself seated. You're going to activate the short foot, make sure it's not coming from your toes, make sure it's not coming from the calf. From there, you're just going to stand up, and now we're putting some weight into it. And what you're noticing is when I actually look at my foot, the foot isn't collapsing. I'm not letting it drop downwards into pronation. I'm maintaining that supinated contact. And from here, you could do what we call sit to stance, which is where you just sit back down. You could relax everything, activate and stand back up. In a way, we're kind of mimicking, by doing a sit to stand squat, we're kind of mimicking the same movement patterns we need to do in a squat. And you'll do that sporadically throughout the day, just practice it. Now, This is one of those things that you don't want to do all the time. Like, you got to give your foot a break. It's just going to overwork it, especially in the beginning when the muscle's deconditioned. If you do too much of it, it could actually make things feel worse. So be cautious of that. If you do feel that the foot's really sore the next day, just give it a break that day and pick it up the day after. Think of it as strength training your foot, just like you would strength training any other muscle at this point. And that's because we're loading it up. From there, once you kind of got a good feel of that, you just start doing this in a regular squat. So you get rid of the bench, and we're going to just remove that. And now you're going to activate the short foot, and you're going to practice doing that in the squat. What you should notice is when you're doing that squat, because the foot's nice and supinated, that knee is no longer going into valgus position or into rotation, because this thigh and leg and knee is fully supported by the foot. So at this point in your programming, you have a pretty good feel of how to activate the foot, but then how much are you going to incorporate that into your squat? If you're doing your maximal lifts, should you be focused on your foot? My answer is it depends most of the time, but usually no. What you want to do instead is think about activating the foot during your submaximal lifts, because quite honestly, when you're doing your maximal lifts, you want to be thinking about keeping your core nice and braced. You don't want to really be thinking about your foot so much, because you want to make sure that everything is nice and strong in the core and you're feeling safe throughout the spine. So instead, I like to focus on doing foot mechanics during submaximal lifts, and I classify that as anything at 60% effort and below, or 60% load and below. Those are weights that you can control pretty easily, and you can focus on using your foot. What you should notice is that over time, as you are activating your sure foot, it becomes easier and becomes less effortful for you to think about while you're doing your squats, and then you can start introducing that more naturally. Eventually, you'll find that this starts becoming integrated in your movement patterning, and that you don't really have to think about it so much, and your foot will naturally just engage while you're lifting. Now, the end goal is to stop thinking about this so consciously. So you have to practice weaning yourself off of activating the foot as much as possible, because you really just want to think about lifting that heavy weight. If you have any questions about how to start incorporating foot mechanics into your list, let me know in the comments below. I can create more foot exercise based content. You can also find a few other videos on my channel. If you like this video, please click like and subscribe to the channel, and I'll see y'all next time. Peace.